And good evening, everyone. Thank you so much for joining us on this Friday evening. I'm Rod Fowler. Megan has the night off. A shortage of life-saving cancer drugs is affecting patients all across the nation, and that includes right here in Lincoln as well. Channel 8's Veronica Barreto joins us now here in the studio with the latest on this. Veronica?
That's right, Rod. I talked to local hospitals and health organizations on how they are coming together to address the national drug shortage. They told me they are prepared for shortages. However, there are some concerns. Officials say a new shortage is forcing oncologists and pharmacists to scramble for alternative treatments.
Right now we are looking at using different wholesalers and working directly with the drug companies and communicating with them down to even the patient level on how to get as much medication as we can.
A study found over 70% of cancer centers across the country have reported experiencing a shortage of two chemotherapy drugs. 93% say they're experiencing a shortage of the chemotherapy medication carboplatin. Those medications are used in combination to cure many types of cancer.
Cancer patients are extremely resilient, and it's amazing how they just deal with it the best they can. You know, they're stressed and they're worried, but in the end, they're not, super upset. They know everybody's trying their hardest they can.
In Lincoln, different healthcare providers and hospitals are working hard to find a solution.
And we also are working as a community with pharmacy, hospitals, and physicians on a weekly basis, trying to get as much of the medications as we can, and then making sure that the patients who need it the most get it.
The organization Nebraska-Medicine says this situation is not new.
Shortages are not necessarily a new phenomenon. We have processes in place to be as proactive as we can.
However, the concern about this shortage is more on what alternative treatments are available.
The difference between this and other shortages is what is available and what can we get by with different agents. In this aspect, there just isn't a lot of other options.
The Food and Drug Administration said it would work with a Chinese drug maker to import these drugs to boost the U.S. supply. And again, health officials in Nebraska are asking people not to panic, as they say there are always options and alternatives for patients when it comes to cancer therapy.
All right, we appreciate you letting us know about that, Veronica.